Hi, everyone. Thank you so much for attending today's webinar, which is Increasing Culturally Specific and Victim Service Provider Access for HUD Fiscal Year 2022 Notice of Funding Opportunity, or the NOFO Continuum of Care, or CoC funds. I'm really delighted to introduce our panelists for today. Beforehand, we will do a little background on the NOFO, but I want to take the time to thank our dedicated panelists who are here and happy to be on board for this special webinar. First, I want to introduce Erika Jones-Haskins. She is the Policy Director at the United States Interagency Council on Homelessness, or USICH. Margarita Guzman. She is the Executive Director at the Violence Intervention Program, or VIP Mujeres. Priya Sybil, who is the Senior Manager of Housing Development at Sakhi for South Asian Women, and Jonathan R. Martinez. He's the Deputy Director of Community Engagement and Partnerships at the New York City DSS. And also myself, I'm Charlene Powell. Again, I'm the Director of Safe Housing, Survivor, and Equity Initiatives at the Safe Housing Alliance. Welcome so much. Thank you for being here. All right, on to the next slide. So what are we going to do here today? We're going to introduce the DVHTAC, or the Domestic Violence Housing Technical Assistance Consortium, and victim service providers, or VSPs, culturally specific providers, presenters, with implementing the HUD CoC housing resources for survivors of color. We're also going to provide a national overview of the critical intersection of domestic violence, race, and homelessness. Today, we're also going to learn about best practices to adapt and implement HUD programs for HUD culturally specific communities. We're going to learn a little bit more about how you can build authentic partnerships and relational connections with culturally specific organizations working in communities to end domestic violence. We also want to increase the understanding among victim service providers and culturally specific organizations for the fiscal year 22 HUD, NOFO, and potential changes in the NOFO that really could impact victim service providers in the application process. We're going to review the core components of the domestic violence or sexual assault bonus project, which is a $52 million set aside for domestic violence, sexual assault, human trafficking survivors, also rapid rehousing, the joint component, and the coordinated entry support systems, and key considerations for culturally specific and domestic violence sexual assault programs for both housing models. Really a little bit of reason why we're here. Also, what we're doing is we're helping communities or community-based organizations know that seeking federal funding is accessible, it's attainable, and these are the tools to get your agency equipped to receive federal funding. Today's webinar will include strategies and helpful tips on best practices for applying for the HUD federal funding. There will be time at the end for direct engagement with Q&A, discussions with technical assistance providers. Like Mary Kate mentioned at the beginning, you're welcome to put your questions in the chat. We have people dedicated to answering those questions. And we also have saved time at the end. Thank you so much for everyone who is already introducing themselves in the chat. Welcome so much. Please feel free to introduce yourselves and say hello, and also state where you're from. We're really trying to serve culturally specific and diverse communities. And also, I really want to acknowledge that I'm using acronyms here, but and there are some acronyms in the document, but I'll try to stay away as much as I can from using acronyms, or we'll ask someone to spell out any acronyms in the chat, because we all use that as usual terms. Just want to get rid of acronyms where we can. All right, on to the next slide. All right, so today, this is being presented by the Domestic Violence and Housing Technical Assistance Consortium, or DVHTAC. Our federal partners that really help us make this work possible includes the Family Violence Prevention and Services Program, or FIPSA from HHS, the Office of Special Needs and Assistance Program, or HUD, and also HUD, the Office for Victims of Crime from the Department of Justice, the Office on Violence Against Women, or OVW, and the Department of Justice. And also here today with us, we're really happy to have the U.S. Interagency Council on Homelessness. Our TA providers that also have been working on this project are Collaborative Solutions, the National Network to End Domestic Violence, or NNEDV, the National Resource Center on Domestic Violence, or NRCDV, the National Sexual Violence Resource Center, or NSVRC, Safe Housing Alliance, or SHA, and also special training, technical assistance and resources and support has been from STARS, the Indigenous Safe Housing Center. Next slide, please. Okay, so bear with me. We're going to do a quick video on the intersections between domestic and sexual violence, racism, and homelessness.
Homelessness is an issue that far too many people face. People of color, specifically Black people, other persons of color, and Indigenous people, experience homelessness in a dramatically different way than their white counterparts. People who hold multiple identities, such as those who live at the intersections of disability, immigration status, sexual orientation, gender identity, and more, experience compounded barriers that further homelessness and housing instability. A recent study found that 66% of people experiencing homelessness were Black, while 28% were white. Black individuals are only 13% of the U.S. general population, compared to 74% of those who are white. Rates of homelessness within Native communities are 3 to 8 times higher than that of the general population. In total, 78% of people experiencing homelessness identified as people of color. This overrepresentation of Indigenous, Black, and other people of color experiencing homelessness cannot be explained by poverty or identity alone. Structural racism, historical policies, institutional practices, and cultural narratives that perpetuate racial inequity put people of color at a disadvantage in obtaining safe and affordable housing. Statistically, women of color are much more likely to experience domestic and sexual violence, and survivors often face network impoverishment. Network impoverishment occurs when the addition of a financially distressed household member places an extra strain on family resources. Oftentimes, we tell a survivor experiencing homelessness to go to a relative or friend's house. However, network impoverishment can cause immense burdens on the existing limited finances and available support from that network. Racial disparities arise at every juncture, from the legal system, to housing, to healthcare, to child welfare, to public benefits. Understanding the intersections between domestic and sexual violence, racism, and homelessness, and applying an equity, survivor-centered lens in our work is the only pathway to stability, safe housing, and healing for all survivors. If we want to address racial inequity, we have to acknowledge it, learn about it, and talk about it, so we can do more about it together. To learn more, visit safehousingpartnerships.org.
Thank you so much for listening. Now we'd like to introduce our panelists. So first up, I'd like to introduce Erika Jones Haskins, who is the Policy Director at the United States Interagency Council on Homelessness, and as I mentioned, one of our federal partners here today. I'm also honored to introduce to you these widely innovative, impactful organizations who lead, like the video mentioned, with survivor-centered, rooted principles that are also New York City domestic violence, HUD bonus, and or rapid rehousing grantees. We are also excited to have their CoC representative here as part of our interactive roundtable discussion, which will be happening a little bit later. And we'll discuss some of the tremendous and sometimes challenging RFP procurement and pipeline process. And with that, I'll give it to Erika Jones-Haskins. Thank you so much.
Hi, thank you, everybody. It's great to be here with you all today. If I could get the next slide, please. I think it's one more after that. Thank you. So as you heard, my name is Erika Jones-Haskins, and I am the Policy Director at the U.S. Interagency Council on Homelessness. I'm also joined by our other Policy Director, who's Katie Jennings, who is also helping out in the chat today. I am going to treat this like if we were all in a room, because in my head, I'd like this to be like if we were all in a room, but we're not. So this would be the part where I'd say, okay, how many people here are familiar with USICH and the work that we do? And I'm going to assume that there would be like a couple hands that are not. And I see a hand that's raised. I don't know if that's a person who needs to speak or not, but I'm going to assume that someone would say that they're not familiar if that was the case. And this would be the part where I do our plug for what USICH does. I think many of you in this call are very familiar with your local continuums of care. And the best way I like to describe USICH is kind of like a federal equivalent of a local continuum of care. Obviously, the scale is a lot different in some ways, but a lot of the work that we do in terms of bringing federal partners together to help us coordinate our response to homelessness and also supporting communities is very similar to like what you will see at your continuum of care. The fun part about that is that unfortunately, we are not in the midst of trying to respond to multiple NOFOs, but we understand a lot of the work that goes together in coordination. Obviously, domestic violence and the issues of survivors is really key because we saw the video about all of the intersectionality between housing instability and interpersonal violence. And I think you can obviously understand why this is a topic that is important for us to have in this space. But I will say for a lot of communities, domestic violence and DV providers and continuums of care weren't always together. They were seen as very separate systems. And I'm going to guess that for a few of you on this call today, on this webinar, that might be a way that it is in your community. And part of our interest in being a part of this conversation was really figuring out how to sort of be able to explain those connections and also sort of make sure that DV providers really had an understanding of what's happening at that continuum level so that you're able to have the capacity to effectively plug in. Getting back a little bit more to what USICH does, as you heard, we sort of do some of that coordinating work. You see here, there are 19 federal agencies that are member agencies for USICH. They are all logos listed at the bottom. And if you ever want to know more about our work, I invite you to check out our website. There's a ton of resources that are on that website and kind of explain a lot about where things are in terms of the work that we do. I want to, if we could go to the next slide, please. Before I get too deep into this, I'd like to make sure that I highlight that there is, we are in the process of creating a new federal strategic plan to prevent in homelessness. So one of the roles that USICH actually very much owns is the federal plan to prevent in homelessness and the creation of it. For people who might have recalled around last year this time, we were going out to communities and asking for people to give us feedback about what was happening with the federal strategic plan, give us feedback on what should be included in the federal strategic plan and sort of be able to help us guide in that process. And I just want to highlight a couple things because I think they're important for this conversation. There is a piece that's in the forthcoming federal strategic plan that's very much focused around prevention. And I think this is something that will be near and dear to a lot of people that are on this webinar, really sort of preventing people people from having to enter the homelessness system by being able to address their housing needs and housing stability if they are, leaving, a situation that's not safe for them, and being able to sort of head that off at the pass. A lot of the prevention that we've talked about in the federal strategic plan is even more upstream from there, which is really exciting. And I think it's the place that a lot of the organizations here sort of play in very well, and kind of obviously can see what happens to people before they have to go to, a shelter door. But I just want to make sure I highlight that so people know that that's a very big piece of the upcoming plan. It's one of the one of the pillars that is featured there. The other thing that I want to note about the federal strategic plan is that in a lot of ways, it is a blueprint for state and local action. So I come from a background of being in a continuum of care, a local continuum of care, and I know what that feels like at a very local level. And I think having a federal plan helps us to be able to sort of say, these are the federal priorities. How does what you're trying to do align with that? And just to sort of give a quick like link to the NOFO, if you are looking at this NOFO, or if you've seen any NOFOs in the past and thought, boy, this might be something we're really interested in applying for, getting into our local competition for, that alignment with federal plans, federal priorities is a really important part to that. So I would say, if you're curious to understand a lot of those priorities, the NOFO interestingly enough highlights quite a few of those. So if you have not had a chance to wade through all of the announcement, I would definitely say to go through it and spend some time there. You're going to have people talk about that in this conversation today, but I think all of those priorities listed there are more than likely going to reflect a lot of the priorities that you're going to see in the forthcoming federal strategic plan to end homelessness. And the last one is that this is designed to be a living document. So knowing that we will be revising this over the years to be able to give additional input, I think will be something that we'll definitely be looking forward to. And I think something that's important in this conversation is this plan is very much centered around equity and centering the experience of people who have lived experience. So I think I say all of that to sort of set up for having providers that are working with survivors at the table is not just important, it's critical, right? As we think about where those federal priorities are going and sort of centering those experiences, we really can't do it without people sort of being engaged and at the table. And this will get me to where I want to talk about in terms of sort of the process as it relates to the NOFO, and where I kind of think you all will be well served to sort of tap in. So if I can get the next slide, please. All right, so when I was asked about this presentation, there's a lot of people who are going to talk very specifically about what's in the NOFO and those priorities. But when I understood the people who would be on this call, one of the things I wanted to do is reflect on what I thought the experience was when I was at a local level, and sort of being able to help make some of those connections. And these are a couple very sort of high level, quick sort of things I think that will help center anyone who is thinking about getting involved in the continuum of care and being able to participate in that local competition. I say that too because I think it's often important for people to remember, and sometimes we don't always know this, NOFOs come out and anyone can read them, but it's a very local process. And I think this year you'll hear people talk about the time window is very short. And I say that to say is that if you have not been in that process, that's a really steep learning curve, but there are things you can do to learn about that process and to be in that space so that you can support your overall community's response to homelessness, but more importantly for this group, to be able to support survivors that are facing that experience. So what I wanted to do is sort of give those nuggets of things that I think everyone should just really be dialed into locally. And I think it will set you up to be able to understand what's in that NOFO and to be able to move forward with being able to dial in. So the first one is understanding national and local trends. Obviously, connecting with promising practices and news is sort of the thing that everyone needs to do. I will say I'm going to plug for our USICH website. If you want to read more about the intersectionality, about domestic violence and homelessness, there are tons of things that are there. You know, the HUD Resource Exchange has lots of information for people who are interested in that. And I would say if you are not on those listservs or someone just forwards you a message, you should get on those listservs to be able to see that information and to be really grounded in what does that mean, and thinking about for you and how you are serving in your community, what does that mean for you as a provider? And what does that mean for the survivors that you are serving and advocating for in your community? I think the other thing is understanding national and local trends. So every community every year usually is doing some kind of count of the people experiencing homelessness in their community. And they have, you know, sub data on people who have come into the system, who have fled domestic violence or have a history as a survivor. And I would definitely say you want to dial into that data and to understand it. If you don't know where to get it, asking your local continuum to point you there is a very good introductory conversation to talk about how you can be of assistance in the larger response in your community. And everyone should be willing to sort of at least tell you where the data is. And if they can't, that is a great opportunity for you to explain how you can help them to get it, so that you know that the people that you serve are truly reflected in the data that is being collected about your community and the story that's being told. The national data is always available via HUD. So if you want to just know what do things look like in general, a lot of local data is there on the HUD website as well, but you can also tap into the HUD CoC website to be able to access some of that national data as well. And that last bullet is about priorities. You heard me talk about the federal strategic plan. So that is a great plug to actually say, when it comes out, please read it. If you're curious to see what is in it, we've done a bunch of presentations that are going to be on our website. And I think Katie has dropped a link into the chat too that can help you sort of see what some of the overall framework is. So if you want to know if what your community is doing aligns with that, that's a great gut check right there to sort of figure out where that alignment is. And if there's not alignment, it's a great opportunity to start a conversation at a community level about how you can be in alignment. And you heard me say a little while ago, the NOFO is usually really clear about what those priorities are for HUD. And like I said, if you see things that you're doing and it sort of backs up what you're doing, that's great. If you see things that are missing that you all have an opportunity to serve and stand in that gap and help to further, that's an opportunity for you to have that conversation at a local community level as well. Obviously, the next one is going to be connecting with your local continuum. I feel like I've talked a lot about that, but the one thing I want to make sure I focus in on is this part about equity and lived experience and access to funding and resources. Continuums should be open, right? They should be something that you should understand how to connect with. It's not a group of people that are in secret. It's supposed to be a public process, and it's also supposed to have very meaningful spaces for people with lived experience. This is the space to sort of step into if you are feeling like that's not something that happens in your community, but it's definitely an opportunity to be accountable. And if you read the NOFO, it sort of talks about how that accountability should look. So I think if you're feeling shy or you're not sure where to, like, if you should be at that table, the answer is yes, you should be at that table. And sort of these are the things that you would be bringing there very tangibly. And it's a conversation that you should be willing to start and to push if you feel like that's not happening. The last bullet I want to talk about is getting help and staying informed. There's obviously some technical assistance that is available to providers. You have some of the folks from the DVHTAC, which is the Technical Assistance Network, that are on this call. If you are not sure what to do, those are great people to reach out to. That is what they're paid to help do. So I would say reach out to them, figure out how to make that connection. You can bring a lot of different things to them, and they're able to help with being able to connect you with resources, other communities. We also on our USICH team have a group of folks who work with nothing but states. They work with the states across the country to help connect people with resources and information. So we can be a resource for that as well. But the folks in DVHTAC are going to really have that knowledge of the issues and sort of the technical side of what you need to do in order to address the things you're concerned about. And also, last but not least, listservs, websites, information sharing, priority setting. I mean, our inbox are probably drowning if yours is like mine, but I will say that those nuggets that people are sending out really are meaningful, and as much as you can digest them before NOFOs are announced, I think is very helpful, because it helps you to be prepared for when funding is sort of coming on the scene, but you've done that prep work. If you could go to the next slide, please. Thank you. Here are just sort of the links for how to connect with us. And I want to just make sure I say, just sort of like as a closeout, as I stated before, NOFOs are a really busy time, right? They're a busy time. Lots of people are doing lots of things. It sometimes feels like the agenda's already set. And I think this year it's going to be very crunched and feeling like those agendas are set. And, there's not a lot of time to get questions asked. And this is where I would really encourage you all to be involved early, even if this is not something you feel like you are able to take on at this time. If it's something that you're like, this is not something we have the capacity to do, this is why reaching out to a technical assistance provider now is just timely. It's why coming to the table and seeing how money is shared in your community, it's why understanding how things are announced and what's the process is really important. So I would say, don't be discouraged if this is not your season to take this on. I would say use this as a learning opportunity and really be prepared to sort of keep staying at the table, so that you're able to sort of make sure that you can advocate for the resources that are needed for the communities that you serve. I think there was a raised hand, but I think it might have gotten addressed. I can't see the chat while I was presenting, so I will pause for a second and make sure that it is good to sort of kick it over to the next person who will be sharing, but I'll take a pause for a sec.
All right. Thank you so much, Erika Jones Haskins. Thank you for joining us today and giving us some great insights on what the United States Interagency Council on Homelessness is doing. And please, as she mentioned, feel free to go ahead and copy over those links in the chat, and we'll be here to continue asking any questions as they arise. So next slide, please. So to give us a bit of an overview of the HUD's Continuum of Care program and the 2022 Continuum of Care program competition, the NOFO, I'd like to introduce Debbie Fox. Dee Fox is the Deputy Director at the she is Deputy Director of Housing Policy and Practice at the National Network to End Domestic Violence. Dee Fox leads national domestic violence related housing policy and provides technical assistance and training to NNEDV's coalition membership and their partners as part of their domestic violence housing and technical assistance consortium. Through NNEDV's policy work, Debbie was instrumental in working with Congress to fund HUD's DVSA $50 million Continuum of Care bonus funds. Dee Fox has over 25 years in the DV and housing field, and I'm also going to put in the chat last year's fiscal year's 21's webinar where she held this same conversation, which really highlighted culturally specific communities. And with that, I'm going to give the floor over to Dee Fox to do an overview of the NOFO. What's the NOFO? Dee Fox.
Thank you, Charlena, for that great introduction. It's really wonderful to be with you all. And I have been a part of these webinars for some time, getting the word out in the field about particularly the DVSA bonus funds that have been going on since 2018, but also just encouraging DVSA providers for a number of years to get into housing and homelessness and affordable housing development as a way to be responsive to community and survivor needs. So what is the NOFO? It is the Notice of Funding Opportunity. So it is the main funding stream from HUD that goes out to communities that addresses homelessness across the country. So the goal of the Continuum of Care program, and so for those who are long-timers or CoC leads or VSPs who've gotten this funding for a long time, you can just do a little email. But basically, for the new folks, it's a response to ending homelessness in our community, and it's a coordinated response for folks to apply for these fundings with their continuum of care to address the needs of all people experiencing homelessness in their communities. And so, as we know, there is the Category 4 definition of serving survivors and those who are fleeing domestic violence or interpersonal violence or family violence or traumas. There's the ability for survivors to have access to these resources as a part of the HUD definition. They are eligible. So we have seen over the years since 2018, the DVSA bonus funds really has seen an increase, major investments from HUD, $50 million to $100 million a year, depending on the year, going specifically to domestic and sexual violence survivors, to a lot of victim service agencies, culturally specific victim service providers, and also to DVSA state coalitions to address rural and statewide homelessness as it affects survivors. So we've seen just major investments and cross-system collaborations, which has been the goal of our work and the DVHTAC Consortium. And we just see when we're working together and more closely and in alignment and in collaboration, these resources are better able to get to survivors. And when survivors come to us to ask for those resources and to screen into programs, we're coordinated and we're able to have a community responsive to where they're going to go and what's the process for them to apply for those funds. So I did want to talk a little bit about just some of the changes or the prioritizations in the NOFO for this year. There are some key changes or improvements year over year. There's there are pieces around how the points are scored. I'm not going to go into the depth or detail of the NOFO of the 150 pages. I'll leave that up to the Continuum of Care leads to do that deep reading. But there are key changes that there is now access to tribes, and tribal designated housing entities can now apply and are invited to apply for this funding. So that's a huge shift and a huge legislative win that tribes can apply for these funds. As we know, Native communities have been particularly impacted by colonization of housing and by the recent pandemic as well. So it's a really important resource for tribes to have access to this funding. And also we have seen another investment from Congress for the DVSA bonus funds at $52 million. So we hope that some new DVSA programs, and in particular culturally specific programs, really take an interest in applying. And I really appreciated what Erika said. HUD funds are not always for the faint of heart. They take a lot of work and a lot of planning and collaboration with a lot of community partners. If this year is not your year, maybe consider it next year. But we really encourage you all to consider applying. And then if you are applying, please, work with your community partners. If you have government entities, state DVSA coalitions, you don't have to go it alone. There are administrative bodies and community organizations, if you're a smaller or grassroots organization, that can really assist you with applying for these funding. There's also the non-competitive dollars for the youth demonstration project in here at $80 million. And then there is the tier pieces around tier 1 is equal to 90% of a CoC's annual renewal demand. And so you can look at that some more in the NOFO as well. And then the last few years, the CoC and the homelessness field and the DVSA field is in the federal government and USICH priorities, we are really looking to center racial equity, and points assigned to that have gone up substantially. So we're hoping that if you are a culturally specific provider or a provider that focuses specifically on issues around racial equity, that you are included in and you should have extra points assigned to that. There is a priority around reducing unsheltered and reducing criminalization around homelessness. Unfortunately, there's been a backlash around people living outdoors or people experiencing homelessness that we're seeing in our country. And we're hoping the organizations that are focusing on reducing criminalization in their community apply. And then those with lived experience, it's really critical to have survivors as part of the voices at the table, at the CoC tables, in addition to other types of people with lived experience at the table, survivor and voices and family homelessness voices. There's often different experiences that can be shared, and their perspective is really critical. And then there's a big piece, and I feel for you all. I know we keep talking about the quick turnaround time, but making those partnerships with housing and health and service agencies. We've seen in the last year through the pandemic, the amazing partnerships with the PHAs, the housing authorities, and the continuums of care. HUD wants to build on that. And then also there's continued prioritization around working on increasing the supply of affordable housing. And then lastly, I should have said this before in the beginning, we're not HUD spokespeople. HUD is doing their own TA and training and putting out information about the NOFO, but we are here as a DV consortium and as a TA provider to kind of do our own lens on the NOFO and encouraging those in our field and the victim services and field to apply for these resources and let you know that HUD really wants you to apply. I'm not speaking for HUD still, but they are really encouraging of DVSA organizations and culturally specific organizations to apply. And we've seen the impact of the DVSA bonus funds really make a difference during the pandemic. And we're still in the pandemic, but giving options that, that people could bypass shelter or go directly to rapid rehousing or directly go into housing and be an alternative source of housing beyond congregate shelter, because we've known that's been a challenge during the pandemic to, house people in congregate settings. And we want to address the health issues as well as the housing issues. As we know, housing and healthcare are definitely intersected, as all these intersectional issues are. So I'm over my time. I could keep talking about housing all day, but we need to listen to the amazing panel presenters who are here that Charlene has organized, and I can't wait to hear you all present. I'm just really glad to be here, and I look forward to working with you all on the other side once you've received this funding, or if you're thinking about applying for this funding at some further date. We're happy to work with you. So I'm going to pass it back over to Charlene, and thank you all.
Thank you so much, Dee Fox. And if you're not following NNEDV, you should be. Go ahead and follow NNEDV on Twitter, on social media. They come out with great policy updates, and that is one organization to watch. Thank you so much, Dee Fox, for giving us a great overview. So our purpose really, you've seen it on the last slide, is really to promote community-wide commitment to the goal of ending homelessness. We're really glad to have members from the New York CoC here today, and he'll address us a little later on during the panel, but we did want to give a little bit of background on what a continuum of care is and how they really are instrumental in carrying out these NOFO funds. Additionally, I just wanted to mention that CoCs, they should use the coordinated entry process, and they're really there to promote participant choice, coordinate homeless assistance and mainstream housing, and also services to ensure people experiencing homelessness receive assistance quickly and make homelessness assistance open, inclusive, and transparent. So about the background, CoC serves as local governance structures for homeless service programs, and their key functions really include managing CoC membership and partnerships, applying for and dispersing federal funding, monitoring and evaluating grantees' performance, establishing written standards for providing assistance, and also managing data. That could be the Homeless Management Information System, or the HMIS, and partnering with victim service providers on comparable databases, providing access to housing resources and mainstream services through coordinated entry. We want to really emphasize that they're really hubs for collaboration, and also really have been sort of an access point for survivors to and really do outstanding work beyond what their role is designed. So just want to continue to mention connect with your locals, your state CoC, and really stay in touch with them throughout the year, not just when the NOFO is coming around. Next slide, please. So for the background, there's opportunities for that collaboration. I'm going to briefly talk about some of those opportunities, which could include two-way board membership, which is really CoC board might look like an advisory or an oversight committee of the coalition or network. They're really that advisory board. They also offer cross-training, which is really equipping you to prepare and manage those federal fundings, and making sure you have everything that you need so you feel prepared in receiving these funds. Thanks to a great webinar that was hosted by the National Alliance to End Homelessness, or NAAEH, yesterday, and their new Executive Director, Anna Leva, she pointed out that point-in-time counts are on page 80 of the NOFO. So feel free to check out page 80 over there. DFOX mentioned it's a long NOFO, but actually it's a great read if you have some time, or do it audio style while you're washing dishes or something like that. But yeah, that's back in the later part of the NOFO. It's about 102 pages, but we also want to give you key pages to look for throughout today's webinar. With coordinated entry, they're really helping to include it to influence how systems interact and engage with each other, and really amplify the methods of housing access and client-centered programs. They're really crucial, and that's something that, working with your CoC in the coordinated entry process would be great. And as DFOX had mentioned, also with tribal nations and indigenous communities, there's also another new NOFO that came out this year. We're not really going to talk about this today, but we're really excited to hear about the unsheltered and rural homelessness NOFO. We'll put the link to that in the chat. And HUD has some really great webinars that address that NOFO. So this year we have 2 NOFOs out, and it really addresses different populations. And that's where I believe tribal nations may really benefit from that as well. Next slide, please. Okay, with HUD Policy Priorities, just a little bit more overview. Is really on ending homeless for all persons, using a housing first approach, and really working to eliminate those housing barriers like insufficient long-term permanent housing, providing services as survivors are really ready to use them, getting survivors housed, and trying to go bypass the waits as much as we can, reducing unsheltered homelessness, and that includes people, survivors with their families. They might be living in their car, they might be living in an encampment, and really also bringing them through the coordinated entry process and into greater housing access options. You can use the NOFO to address these populations. Improving system performance, partnering with housing, health, and service agencies. And really, I just want to ask people to be a little bit more creative when it comes to health. That doesn't always mean your local doctor. It can mean the local community neighborhood clinic. That's really one of the access points for survivors. Getting in touch with them, those non-traditional partners, and really seeing how they can, how we can all work together to address accessibility. People who aren't really able to get to the main area of places. We need more culturally specific areas that are really address domestic violence to get the word out that there are services available. Racial equity, fair housing. We all know it. We really should work towards ending housing discrimination, which really happens on a survival level more often than we would like. And considering the audience you are serving, really understanding culture difference, sensitivity measures in populations, the complexities of different populations, also thinking about intersectional things like food spikes, food deserts, where there's pricing that's people aren't getting the nutritional needs that they really need, diaper banks, and people lost employment. Just thinking about all these things, especially as we've gone through the pandemic, trying to intersect all of those things that really, really umbrella racial equity inclusion. And also including persons with lived experience and making sure it's not a checkbox. We want to make sure that we have many layers of programming that have survivors of domestic violence, intimate partner violence, sexual assault, human trafficking at different levels of policy engagement, and realizing that survivors are really the experts in their own lives. And we want to normalize the collaboration of the survivors instead of siloing them and feeling like they're a stereotype in a room. Next slide, please. With the NOFO overview continuing on, eligible projects include permanent housing, which is rapid rehousing, and also permanent supportive housing. We have a couple of presenters here today who are grantees of these types of funding. Also traditional housing, which might be renewal funding for those who aren't new. The joint component, transitional housing, rapid rehousing component projects. Really what the joint component, it can include the combination of short-term crisis housing and long-term permanent housing up to a community, and it's really up to your community to decide how much of each type of housing to offer. And I just want to indicate here, if you want to get a little bit more in depth about the joint component, please refer to the webinar that's in their chat. Really describes how lays out the rapid rehousing and joint component program. But just want to highlight that survivors are not and should not be required to enter temporary housing first before they receive rapid rehousing assistance. Projects should really speak to how they will assist survivors to move into permanent housing of their choice based on their strengths, their needs, their preferences, and their financial resources. Next slide, please. A little bit more on opportunities. So with consolidating projects, that really sometimes it might be easier to manage if you're consolidating things together. Transitional grants. So let's say you had a rapid rehousing project. You can move towards a more permanent supportive housing if you want to make use of a transition grant. So if you're moving from one type to another, then that would encompass the transition. Also with the expanded DV bonus, really, if you need more money, that's what the bonus is there for, which was granted out in 2018. So we're happy that it's been really elevated again. And we want to encourage that the $52 million allocated to this, and really want to make sure that we can have those dollars serve communities on a local level. The bonus projects serving survivors will, as I mentioned, will give more interesting creativity on how those projects work during our panel. And just note that there's no one size fits all to this. And a special hint, another opportunity here to ask survivors what they would like to see would be crucial, and develop that qualitative and quantitative feedback, and also influence more survivor leadership opportunities. Don't make the assumption that you know what the community needs. Ask the community and let them lead. And you also want to encourage, we want to encourage partnership with healthcare providers, as we mentioned, and and also CoCs to really center racial equity in their projects. Next slide, please. With that being said, I hope you like hearing my voice. And if not, then we will go ahead on to our beautiful panel that we have today. I really wanted to say a little bit before I introduce our panel. I just wanted to say a little bit more about myself and why I'm here. And I really believe that vulnerability is the key to transparency, recognizing that in many marginalized communities of color, culturally specific organizations, they really play a vital role as your essential frontline providers and advocates. Although more than often, they might not be aware, they might really not be aware of the funding opportunities available, and they might not have adequate guidance on the administrative process, or simply know someone who knows another person that you can trust and that they can seek out to as a coach, and really coach them on how to achieve these funding goals. As a person with lived experience, I felt like that was lacking in my community. So really, really proud to introduce our speakers here today who can really amplify what's going on the ground. First, we have Margarita Guzman. She was born in El Paso, Texas, and Margarita Guzman is a queer Chicana and a survivor of intimate partner violence. She received her bachelor's degree from Georgetown University and her law degree from George Washington University of Law. Upon graduating from law school, Margarita established a legal clinic for indigent Spanish-speaking mental health consumers in New York City. Her legal practice later focused on representing primarily Latinx immigrant survivors of domestic violence in housing, family immigration legal matters, as well as teen and young adult survivors. In 2013, she entered civil service at the mayor's office to end domestic and gender-based violence, or NGBV, where she ran the Bronx Family Justice Center until she joined the violence intervention program known as VIP Mujeres in 2017. She currently serves as executive director at VIP, working with largely immigrant and low-income Latinx survivors of domestic and sexual violence. As a survivor and as a lawyer, Margarita has lived the limits to criminal and civil legal responses to violence and seeks to increase restorative and transformative justice practices to support survivors and change abusive behaviors. I'd also like to welcome Priya Sybil. She is the Senior Manager of Housing Development at Sakhi for South Asian Women. Priya joined Sakhi as a volunteer in August 2015. Priya has a bachelor's and master's degree in English literature from Delhi University. She began a career as a journalist and documentary film producer. Starting in the nascent broadcast news industry in India in 1993, she moved on to directing travelogues and documentaries based on human interest stories. After a 20-year career as a journalist, she started feeling need to work in social workspace to be able to create value in society in whatever modest capacity she could. As part of the Sakhi team, she feels committed to empowering survivors of intimate partner violence and representing the South Asian diaspora in a survivor-led movement for gender justice. This motto at Sakhi is her inspiration, and today Priya manages the Sakhi's housing program and strives really towards tailoring services aimed at providing long-term sustainability to survivors who receive rental assistance through their transitional housing and rapid rehousing programs. I'm also like to welcome Jonathan R. Martinez, who is the Deputy Director of Community Engagement and Partnerships at the New York City Department of Social Services. And as we mentioned throughout the slides, the critical work of the Continuum of Care, I really want to welcome our panelists and bring down those slides. All right, so welcome everyone. So I just wanted to Thank you for joining our roundtable discussion today. And I have a few questions that we'd like to kind of target around about really centering culturally specific organizations and more awareness of this funding. Now, one of the things that we want the audience to know today is that service providers can use the HUD funding to build organizational capacity. Priya, would you mind explaining some creative ways you've used rapid rehousing funding or NOFO funding to increase your bandwidth? Maybe, for example, in your hiring process, or some tips in securing trauma-informed staff. Please start us off, Priya, and also Margarita, if you have anything to share, please feel free.
Thank you. Hello, everyone. Thank you so much, Charlena. This has been such an engaging discussion so far, and I hope to answer your questions to the best of my ability. Yes, thank you. So a housing specialist was actually the first hire we did with the HUD grant funds. From its onset, housing had been a part of our economic empowerment program, and we used to help our clients with applying for rental assistance to HRA, connecting them with home base for FEPS and City FEPS vouchers, make NYCHA applications and such. However, in 2019, we received funding from Department of Justice's Office on Violence Against Women to provide transitional housing to our survivors of gender-based violence. That has been actually an incredible resource for our clients, and we saw some huge success stories emerge out of our transitional housing grant. And then later in 2020, we received the HUD grant, and that is when we really decided to make housing as a separate vertical and professionalize the role of our housing staff, manifesting our ED Mera's vision. Sakhi's housing program was expanded to help survivors gain stability in their communities and feel empowered during this time to build a foundation for long-term sustainability through services like job training, budgeting, increased employability, etc. So the housing department now consists of a housing manager, 2 housing advocates, a volunteer, and an intern, and these are all funded by the grant. My own journey in Sakhi has actually involved, as you mentioned earlier, Charlena, starting off as a volunteer in 2015 through working full-time as economic empowerment advocate to now leading the housing program as senior manager. We also got our staff trauma-informed trainings and things like that. So a creative way to do it, in my opinion, would be really, I think, to identify in-house personnel and train them on the job, folks who really know the workings and culture of your organization. Personally, I feel that would have an advantage. They would have, some in on the clients, on the survivors they work with. Also, I think the culture of an organization, like we are specifically working with survivors of from the South Asian diaspora. So I think to identify and train in-house staff, I think was a big advantage for us.
Yeah, I think that is, I'm just going to add really quickly to what Priya said, which is the opportunity to build, to foster leadership within, especially if you're a culturally specific organization that's buying for a target community that you are serving. Your staff are often representative of those communities, and that means that you're fostering leadership amongst those communities, not just within the organization, which is absolutely important, like upward mobility within the organization really matters, but also externally with other partners, right? So now we are part of this CoC, we have a voice, we have a place at the table, we have a way to both gain information and bring it back to our communities and to inform the processes of the CoC in a way that really gives voice to our communities. So there's this extension to have an impact on the practices and policies in that way that we would never have had normally as a fairly small, culturally specific organization. And because I'm nerdy about things like data, it also really gives us an opportunity to build our systems, right? So our fiscal and our data systems to handle a federal grant, right? And that's a really big deal. That's like a whole level up for smaller organizations. And it gives you not only the opportunity to really build that infrastructure within, it also gives you an opportunity to brag about it, right? Like when you're applying development-wise and fundraising-wise, it means a lot that you can manage a federal grant. It means a lot to other funders. It indicates that you have lots of infrastructure necessary, and that and I think that it attracts attention in a way that you want it to, right? Like we're traditionally underfunded organizations. And so it really helps to build some capacity and opportunity in those directions. And even if you are not thinking about applying this round, or if you want to apply, or even if you apply and don't get it, it opens the door to the conversation, right? You start building a relationship with the CoC. And it really starts helping you to see what it is you need to aspire to, like what you would need to shift within the organization so that you can have a successful application. And it's a great ongoing conversation. It's not like if there's an application and you don't get it, don't be discouraged. It is really just the first part of the conversation.
Thank you so much. And Priya, what do you think are some of the initiatives that culturally specific organizations perform to decrease housing barriers that may not be adequately articulated or calculated? For example, effective language accommodation, interpretation, resources needed to promote communications accessibility, and really want to speak to how HUD-based funding has helped overcome some of those barriers specifically culturally specific organizations face.
Yeah, thank you so much for that question, Charlena. So, I just wanted to highlight very quickly some of the biases that our clients face. They're all, South Asian survivors, immigrants mostly. So I think on top of the list for me would be the single South Asian woman bias. Divorce or separation is still very much taboo in the South Asian diaspora. It's very uncommon to see a single South Asian woman fending for herself. Patriarchy normalizes women not leaving the house. Community spaces are mostly dominated by men, and the expectation is really to be a quiet homemaker. Secondly, reduction in income after the abuser or the primary earning member leaves, right? So this major loss in income source forces clients to start all over, and most of them they've never worked before. They don't have credit cards. They have a poor credit history. A lot of them are victims of identity theft. They don't even know that the abuser is, got credit cards in their name and raked up huge debt. So all of these factors are huge barriers to self-sufficiency when they actually decide to leave their abusive situation. Then there's also the piece of community pressures. So complex patriarchal relationships within the community can really limit housing options. So living within the community can give great comfort on the one hand, but at times, patriarchal community pressure limits the client's housing options. This is because of these complexities, clients can face great shame and pressure to stay with the abuser. So oftentimes they decide to not leave because of the shame associated with it. Then also landlords are suspicious about renting to single female clients, right? Though due to patriarchal beliefs, there is also the fear and suspicion that the client or the survivor will not be able to afford long-term rent since she does not have a male authority or a husband or a father to provide for her. Last but not least, in my view, is also the complexity of immigration. And in the video and earlier we spoke about the intersectionality of that. A lot of our survivors are illegal immigrants and do not want to engage with the legal police system or police system for fear of deportation. They're not eligible for public benefits. They're not eligible for NYCHA or Section 8 housing. So we tackle most of these issues through advocating within the community. And we've, exactly as Margarita mentioned, we've used these funds to really develop our infrastructure as well. We've got language lines, we've got linguistically specific personnel. We've got staff that acts as interpreters, that mediates between, the system and the survivor. Oftentimes, because of the isolation, the survivor does not even feel confident dealing with larger organizations or networks or the system, right? So we have that language support. So we've got that. And we've also partnered with tenants' rights organizations, advocating for tenants' rights. We do a lot of outreach. We go within the community. We go to religious institutions. We talk to landlords. There's a lot of landlord harassment. There's a lot of biases amongst the landlords, right? Because they're, as I mentioned before, they look at survivors with suspicion. So we actively go and do outreach with landlords, and through our language lines outreach, we've really, like Margarita said, developed this broader infrastructure, and we use that to really identify and work towards these barriers and getting rid of these hurdles and obstacles for our survivors.
Thank you. Thank you so much, Priya. Next one's for Jonathan at the New York City CoC. And in really nearly every community, Black, Indigenous, and other people of color or BIPOC community are substantially overrepresented in the homeless population, as we mentioned in the video. HUD this year is really emphasizing systemic and programmatic changes to address racial equity within continuums of care. In the review and selection process for applications, how has racial or ethnic equity practices played a role in the grantee award process?
Thank you. And it's a great question. To preface it entirely, the New York City Continuum of Care is committed to fostering and supporting an inclusive, equitable, and just network of providers with the common goal of eradicating homelessness. And that's our baseline overall of who we want to engage with. And we encourage applicants during the planning phase to really involve a diverse group of stakeholders, to really give the opportunity to build a robust program that echoes the voices of all those that they want to serve, that they want to be engaged with, and the providers who are already doing the work. And the real goal that we look for is to see a program and a project that's been developed that's viable, that can move forward. And to move into the point of the question of the review and the selection piece and the ranking, that's really comes into a two-part situation. The first part deals with new projects that are received during the new project RFP period, which we're currently going through, which is due on August 23rd. Now, as we've heard, it's been a crunch time, not by our doing, but we're here to do it. So even if that sounds daunting, don't be discouraged. Take a look at it. Look at the application. Look at the NOFO if you want to. That's what the CoC is here for. We'll read the NOFO, we'll give you the RFP. So give it a read, give it a shot, and we're also here to support during that process. So even if you submit an application and you're not too solid on it, we're here to build that off. And that is the first step, as we heard prior. And overall, we also have an overview document, an introduction overview document that does detail how we're scoring and how we're breaking things down with the application review scoring matrix. And that'll be in section 8 of that overview document. And I'll put that in the chat, a link to that. And based on these scores and the overall strength of the application, new projects are selected for inclusion in the CoC's collaborative application. So what we have is we have the NOFO, and we reply to the NOFO with our collaborative application, and we build out that collaborative application with the RFP projects that we get through our whole RFP process. So it's that whole stepwise. We get the RFP, we build out our collaborative application, and we apply to HUD. And the second part with the ranking deals with our independent review team, and they meet throughout the year with the steering committee, and specifically during this NOFO time, to determine the ranking priority for new and renewal projects. And a lot of that is informed by our scoring matrix and by the way that projects are developed. And a lot of this information is really communicated through the program design. And that's the best area where a program can really showcase the work that they want to do and that they will do moving forward. And that's where we pull that ranking priority from. And I know that can be a mouthful, so I'm always here to support, and I'll have my contact in the chat.
Perfect. Thank you, Jonathan. Thank you for all your incredible work in New York City. So I really want to work a little bit backwards. Margarita, as you are aware, many persons with lived experience, including survivors of domestic violence, sexual assault, gender-based violence, and human trafficking, have difficulty navigating systems created to support their housing journey. What are some baseline ways that federal funding process can help to direct housing navigation barriers leading towards long-term housing stability? This can include using a housing first approach. Go ahead, please share, Margarita.
Yeah, no. So just to share from our experience at violence intervention programs. So interestingly, all of our programs serve about 85 to 90%, depending on the year, Latinx identified folks. But in our residential programs, right, our emergency shelter and our transitional programs, it's the other way around. We only serve about 15% Latinx identified folks. And it's because our communities are largely immigrant, and our immigrant communities did not trust and did not want to engage with the federal housing program. They were really scared to go into shelter. They were really scared of unintended consequences connected to potential deportation or other law enforcement like involvement. And they were really worried mostly that there was just no way out, right? That they would get stuck in this like kind of a pattern of chronic homelessness and that they had no path out because of their immigration status. And there was a lot of misinformation about what immigration status was required to be eligible for different strategies to get to permanent housing. So what was really helpful for us, having had years of providing both shelter and transitional housing, was this incredible opportunity at rapid rehousing, right? Which the goal of which is to either avoid shelter altogether or to really reduce the amount of time that a person has to stay in shelter. And it gave us the opportunity to talk to folks about this is a strategy. It really opened the door for a lot of our community members who may have otherwise thought, if I have to go into a residential facility, I'm absolutely not going to do that. So rapid rehousing really gave us another critical and super important strategy to help connect our community of largely immigrant folks, who's our target community, into permanent housing. So that has actually been really helpful, really effective. It's given us another way to talk about and try to sort of clarify misinformation about which families are eligible or not, right? We're still sort of recovering from the time period in the last administration where the potential for mixed status families to be eligible was going to be eliminated, right? Like that still sticks around in community, and we still need to do a lot of course correction and accurate informing to make sure that people aren't inadvertently not taking part of something that can really, really address long-term solutions for them. So I just wanted to offer that up as an example that we've seen at VIP on how specifically rapid rehousing helped to overcome a lot of barriers for long-term and permanent housing solutions for our community.
Absolutely. Thank you. And also, bearing in mind as we're continuing to endure COVID-19, have another question for you, Jonathan. It's incredible ripple effects on homelessness COVID has been. Really, how has systems performance measures played a role in the prioritization process and programming efficacy and really efficiency? During COVID, we had programs roll out with emergency rental assistance and voucher allocations. How has it been, really in your office?
Colin, that's a great question. So overall, it's amazing to say that COVID didn't have much direct impact in our the way that our evaluation took place, which is where we actually look at our program performance. And it did not then play a role in our prioritization of programs. What we noticed is that a lot of programs are actually able to pivot where needed. Of course, programs suffered in terms of how they were serving their clients right off the bat. That was a given, but the way that we did our evaluation was initially to see, let's see how folks measure up. Let's see exactly what's going on. If we change our metric before we actually measure, we're not sure where the issues do lie. And we noticed that a lot of program scores went up, but we addressed areas where programs were suffering, and we offered appropriate TA. Another important fact is that when new programs that come into the CoC, they're not evaluated on their first year. And that's not because we don't want to know. It's simply because of the way that the timeline is structured. With the federal fiscal year, programs will receive funding in theory in July, and the federal fiscal year closes by September 30th. So there's not enough time to actually get a full substantial evaluation. So it's kind of like a pass on that first round. But overall, to the point of this question, the program efficacy did not impact their prioritization with regard to funding. It really just highlighted areas where we could reach out and support our different programs that were in the CoC. So it was more of an internal metric that allowed us to see what was going on.
Thank
and
you.
provide guidance with the other programs that opened up.
Absolutely. And in meaningfully incorporating persons with lived experience, Margarita, into initiatives stated in HUD applications, what are some ways that your initiatives really help those survivors? And this can really include survivor compensation methods, economic justice agendas, leadership and entrepreneurship training, which VIP has been really great in this in New York, and really gathering recommendations from the survivor's perspective. How are some ways to meaningfully incorporating survivors?
Yeah, thank you. So we use a few different strategies, and I think the great thing about organizations that are very close or within or led by the communities that they're serving is that this feels organic in lots of ways, and it's important to also frame it in terms of a strategy, right? Like sometimes we don't always think of the way that we do things as strategic as they actually are, because it's just the way we do things. So this might not sound new to a lot of you, and it might sound new to some, but one of the things that we start out with is first and foremost gathering feedback from our communities, right? I think you've heard that thematically from Charlena and from Jonathan at different points in the presentation, is how important it is to be sure that as a program, and before you launch into a new program design, that the community that you're going to be targeting with it is asking for that exact design, right? Or that their needs are informing the way you are designing the program. So we are constantly doing listening sessions with our survivor community. It's important to offer incentives when you do that to make it worth people's while. And we also activate our promotoras, who are a group of community organizers who are all survivors and activists and Spanish speakers, to coordinate in their community to get community feedback. So we are asking our survivor community, but we're also asking people who aren't getting services at VIP, but who are still part of our survivor community. So sometimes you can skew data by talking to the people who are already getting services from you. And this helps us to hear from people who aren't getting services, but whose information really matters in the design of programs. Because arguably those are the folks you're really trying to reach, right? The ones that you haven't reached yet. So we have a really community-based strategy for collecting the wisdom of our community members and hearing what their needs are. And that has led to a lot of really great work for us, right? Like in addition to the permanent housing strategies and expanding to rapid rehousing a couple of years ago, we've also launched an economic justice project, which really focuses on building small businesses and cooperatively owned businesses amongst survivors and immigrants who may not be eligible for traditional workforce model, right? Like if there's not social security numbers or ITIN numbers, this is an opportunity to earn income in a completely lawful way. And we help them get their vendor's licenses and organize their development, their business plans and their business cards and other marketing strategies online and in person. So it's given rise to a lot of different practices at the organization that really all help sustain the long term. Because even if you get somebody into permanent housing, which by the way, I mean, I think it's probably true across the country, but in New York City, it's like running small miracles, then they also need to be able to pay the rent from, like as long as they're going to be there, and looking for different strategies for increasing income. It doesn't always have to be, it might be that the small business they open with us is a side gig or just adds income to the other many jobs that they are holding down. But it's income that they have control over, and that I think also really recenters them as the people who are in control of their finances, which very often is not the experience of survivors who are coming to us. So I'll stop right there, but those are some of the ways that we've gone about it and some pretty great outcomes that have come of it.
Thank you so much, Margarita. And I just want to do a quick time check. I'm aware that we have a few more minutes, about 7 minutes for our roundtable today. Have a couple more questions that I'd love to ask. And I know there are some questions in the chat. Please feel free to continue to ask questions in the chat. And we, like we said, have dedicated people who are helping to assert those questions. I'm trying to leave about a couple of minutes so we can do quick Q&A as well. And with that, I want to pass my next question over to Priya and also Margarita. What are some misconceptions of the process or assumptions of applying for federal funding that you can pass on to new applicants, challenges and lessons learned from that angle? This may include reporting duties, site management, addressing gaps in the system, and necessary audits. Would you both please share with me some misconceptions, demystify this process for us?
Yeah, thank you. I have to preface my answer by saying that this is a fabulous grant. And once you have your processes in place, and once you've got it all together, it's life-changing. It's been life-changing for our survivors. But I also have to say that it's been like an ocean, and the deeper you go, the more you feel that you need to explore. It was very, very daunting, and this is more to folks who are thinking about applying. So I think for us, talking about our experience at the outset, foremost was understanding the role of CoC versus your HUD contract manager, right? Who to go to for what? Learning about I think what's important, and I think Jonathan has talked about this, maybe even Charlena has brought this up, I think it's very important to learn about your local CoC. And then so basically what affects DV organizations versus other CoC grantees, there is a difference. There are certain rules that are, specific to DV that are not applicable to the larger pool of grantees. So I think one incredible thing that was done was we had a lot of questions around CAPS, the coordinated entry system. I was like totally thrown away, but then later I was relieved to hear that as a DV organization, we were not supposed to, or we were not required to do the coordinated entry because of confidentiality. Now, confidentiality is a huge piece with DV organizations, right? So, so that was one. Also, understanding the whole HMIS system. It took us months to get our head wrapped up around that. Now, we finally got that going, but really, so that was also a struggle. That was also a challenge. We need to really, swim through the dark sea to really figure out how to navigate that. But I think it's very important to understand. I think eventually there was the smaller DV-RRH group within the CoC that was extremely helpful. So whatever challenges that was specific to domestic violence organizations, VSPs, were addressed in that. So we spoke about challenges, we came up with solutions. So I think that was a great, that was really amazing. But I think what's important to know is who to go to for what aspect of the grant, right? Whether to go to the HUD contract manager or to go to CoC. So if there's anything financial, budget related, extension of grants, expansion, spending, your contract execution, the minutiae of the contract, audits, I think the place to go to is HUD. I think CoC, and maybe Jonathan can attest to that, your APR, your annual progress report, your evaluation, performance monitoring that Jonathan, I think, spoke about briefly, the application process, I think general advice and technical assistance, right? TA, for that you go to CoC. There are certain rules specific to the local CoC's RFP that could be in addition to what the HUD requires. I think for all that, the place to go to is your local CoC. But I would underscore one point. It would be hard to navigate. It just seems very daunting because it's huge. But the positive is that they're always there. You could have a big issue. You could have a small challenge. Any question you have, I think you should just reach out. No question is silly enough. No question is stupid. You can just, I think, address it. I think the answer is to reach out because there'll be a lot to navigate. And also, I think, like it was mentioned earlier, I think it'll be helpful to get in touch with organizations who have been through the process already to understand or to know what the challenges were, what to expect, basically.
Yeah, I don't have a whole lot to add to that. I thought it was such a thorough response and very similar to what we experienced. And I want to say that on this panel, not as some sort of gold star example of how to succeed in all the evaluations and get the best scores. We have absolutely had years where we struggled and years where we ran into issues and years where we didn't understand something and had to go back and sort of like redo or rewire our database, not rewire, you know what I mean? Not very good with databases, restructure it, you know, like figure out exactly what it is we were doing that was accidentally under accounting or, you know, I'm just saying like we've run into our share of issues over the years. And it's that strong relationship with the CoC and with fellow grantees that has helped us to sort of get our handle on what it is we need to be doing and identify how we can improve our structures. So the very first question you asked us, Charlene, was about how this helped us to build our capacity. There's a lot of ways at the very beginning, but it's also an ongoing thing, right? Like we are constantly improving our capacity within the organization to manage this grant and to improve our outcomes and to read our data. And it's been really, I can't emphasize enough how helpful it is to have the CoC. I was confused when I first heard of the CoC. I was like, wait a minute, HUD is our grantor though. So what, I just don't get it. Like, I don't understand this process. But really, and somebody else said it earlier, it's the localization of the process. It's understanding that housing doesn't look the same way in Omaha as it does in Brooklyn. And so we need local people to help us walk through the issues that we are going to be facing. And it hasn't been all roses, and we have gotten through it, right? Like, because this, as in all other work, whether it's movement-based work or other nonprofit, you know, if you consider the nonprofit work movement-based work, it's relational. It's all about the relationships and building them and building that trust.
Absolutely. And we are up on time. We want to really thank everyone for coming here today. I have one last question before we end our panel. And also, please feel free to reach out to these incredible organizations. They'll put their information in the chat, and we're recording here today. So please come back and watch over for your staff who wasn't able to be here. What advice, let's all give a quick note of advice for smaller organizations looking to seek grants in general, just in general. If you can give us, our panelists, if you can give us 2 lines of advice for new culturally specific organizations who are just about to hop in the water, please.
Yeah, I can very quickly. Oh, sorry, Margarita. Sorry, you're good. Yeah, so, somebody had mentioned this, and I think it's a very valid point. It's very important to assess your organization's readiness to take on a major government grant. You may not be ready to take on a huge contract, so you can consider being a subcontractor to a larger grantee. Wait. Take the time you need, look at your capacity, build your capacity. That's extremely important. This is an annual funding stream and a very reliable one. There will be a NOFO every year. And you will have many chances. Get to know your local CoC, speak with other similar organizations. Feel free to reach out to us, to VIP Mojeras. Get to know your current grantees, get to know your local CoC. Going into pre-application, info sessions really help. Webinars like these will help. So really, HUD was our second grant, so it helped. But really, I think you need to understand your organization's readiness, is what I would say.
I agree with Priya and concede my time to Jonathan because I think people need to hear advice from the CoC.
I think y'all are the best resource, but to that exact point, it may seem daunting, but really building out a program that is in line with your mission, your vision, and your interests. Don't look at our application and then build the program. Look at yourselves first and build the program, because that's what's going to showcase a really successful project that's really heard the voices of the people they want to serve and the providers in their community. And those info sessions, those listening sessions that are incentivized, I think that's amazing. Really advocating for people to be valued for their time and for their contribution to this work. And we're always here. I put our contact info in the chat, and even if you just want to have a conversation as to what is a CoC, we're here for it. So don't be afraid.
Mary Kay, if you can put up our last slide for today. Really want to thank everyone for joining us, and thank you to the Office of Violence Against Women for making this webinar possible, and really encourage you to go ahead and apply and read up on that NOFO and really celebrate the news with your communities. Here's the link to the NOFO, and take care, everyone. Thank you for joining us.
Thank you all.